Hey Maria, you tend to be on. Can you take this chart for me?
Sure.
For your patient in room 20, it's a 25-year-old female. She took a fall this morning and now she's having a severe headache.
Okay, sounds good. What are her vitals?
She's a little hypertensive, but other than that, everything looks good.
All right, sounds good.
You better not say anything.
Come in.
Hi, my name is Maria. I'm the PA. We'll be doing your exam today. And who do we have with you here today?
I'm her girlfriend, Camille.
Okay, Miss Stefanacci, what brings you in today?
Oh, I just have the worst headache of my life.
Can you stop being so dramatic? She just has a little headache and she kept talking about how she needs to go in. I told her she really didn't need to go in.
And when did that headache start?
This morning, I think. Slight, just bothering me.
Okay, and can you take me back to this morning? What was going on when you first noticed the headache?
Yeah, I was making breakfast and I think I tripped or something. Right?
Yeah, I wasn't looking.
Okay.
Can you describe the headache for me?
It's just like a throbbing pain. It feels like the worst headache ever. I've never had this before.
And does the pain radiate anywhere else besides your head?
Yeah, my neck kind of hurts.
On a scale of 1 to 10, with 10 being the worst headache you've ever had, how would you rate this headache?
A 10.
And have you tried anything to make it better?
I gave you Tylenol, didn't that help you?
No.
And how much Tylenol did you give her? Do you remember?
I think like 2 pills in the bottle.
Okay, and when was the last time she took that?
An hour ago?
Okay, you're right.
And does anything seem to make it better?
No, I just wanted to stop.
And does anything seem to make that headache worse?
The light.
Can we just turn off the lights or something?
Yeah, no problem. We can dim them. And are you having any other symptoms besides that headache?
Yeah, my neck is stiff. I'm like nauseous. I think I vomited earlier.
All right, so that neck pain, can you describe it a little bit more for me?
Stiff.
And did that neck pain start at the same time the headache did?
Yeah.
And on a scale of 1 to 10, how would you rate that neck pain?
Like an 8.
Oh, you're so dramatic.
Okay, and so for the nausea and vomiting, when did that start?
Just recently, like a couple hours ago.
And did it start right after the fall with all the other symptoms?
Yes.
Okay, and about how many times have you vomited today?
2 times.
And since this morning, have you been able to eat or keep anything down?
No.
Okay, have you had any loss of consciousness, any dizziness, any weakness, or any changes in your mental status?
No.
And how has this headache affected your daily life?
I can't do anything. Not even sit or look at this light. Can't do anything.
I'm doing all the work in the house now.
That must be really difficult. Would you say that's your main concern for today?
No, I just want this headache to go away.
We just need something to shut her up.
Okay, so I'm just gonna ask you a bunch of questions to make sure we didn't miss anything. It's just a series of yes or no questions, but feel free to expand on any of them, okay? Okay, have you noticed any skin changes?
Yeah, like on my back and my neck.
What do the skin changes look like?
Oh, they're like bruises.
Okay. Any other sores or rashes?
Nope.
Any fever or chills? Any changes in vision besides your sensitivity to light?
No.
Any hearing loss?
No.
Any nasal congestion?
No.
Any sore throat?
Nope.
Any cough?
No.
Wheezing?
No.
Any shortness of breath?
No.
Any palpitations? Do you feel your heart more than you normally would? Any abdominal pain? And you mentioned the nausea and vomiting, correct?
Yes.
Anything else that I missed?
No. Just the neck stiffness.
Okay. So we're just going to switch gears a little bit, and I'm going to review some of your past medical history. Do you have any medical conditions?
No.
Any hypertension? Diabetes?
No.
Heart disease? Or any high cholesterol?
No.
Are you on any medications?
No.
Any prescription?
No.
And no over-the-counter besides the Tylenol that you took?
No.
Do you have any allergies?
I think to Cipro. I think that's what it's called.
Okay. And what happens when you take that?
I get a rash.
Okay. Any recent surgeries?
No.
And how about hospitalizations?
No.
All right. And your family history? Are your parents alive?
Yep.
Do they have any medical conditions?
No.
No hypertension?
No.
Any diabetes?
No.
Any heart trouble?
No.
High cholesterol?
No.
Okay, just a few more questions. Do you smoke tobacco?
No.
Do you drink alcohol?
No.
Do you use any recreational drugs?
No.
Are you up to date on all your immunizations?
I think so.
And when was the last time you saw your primary care provider?
A year ago.
Okay. I'm just going to ask you some questions about your sexual history. There's a little sensitive questions. Is it okay if I proceed? Okay. Are you sexually active? Do you sleep with men, women, or both?
Woman.
Any history of sexually transmitted diseases?
No.
And when was your last menstrual period?
Like a week ago, I think.
Okay. All right, so now we're going to start the physical exam. Are you comfortable with your girlfriend staying in the room?
Yeah.
We're going to do a quick eye exam, so this is going to require a bright light in your eye. I know you said it was really sensitive, so if you need to stop at any time, just let me know, okay?
Okay.
Okay, I'm just going to consult with my supervising physician, and I'll be right back, okay? Hey, Dr. Balin.
Hey Maria, how's the case in room 20?
So a 25-year-old female had a really severe headache after a minor trip that she mentioned. She's having photophobia, nausea. She vomited about 2 times. She said she took Tylenol, but it really hasn't helped.
Any loss of consciousness?
No loss of consciousness.
Okay, what's your differential?
I'm thinking something neurological. I would want to get a CT on her. I'm not sure if her story's completely lining up, though. She just said it was a minor trip, but it seems more severe than that.
Okay, what were your physical exam findings?
Her eye exam, she wasn't really able to take the light too well, but I did see some pre-retinal hemorrhages. She had neck pain that was indicative of some meningeal irritation. Cardio and pulm exams were completely normal, as well as her neuro was completely normal. But her skin, I did notice some fingerprint and hand-marked bruises. Her girlfriend was pretty overbearing in the room. I've never really had a domestic violence case. I was wondering if you could help me out with that.
Yeah, absolutely. Have you asked any screening questions yet?
Not yet.
Okay, so the first thing we're going to want to do is separate her and her girlfriend, and I'll go ahead and I'll ask the screening questions, and in the meantime, let's get her to CT as soon as possible.
Sounds good.
Hi, are you Bianca?
Yeah.
My name is Dr. Balon. Nice to meet you. So your PA Maria just explained your case and what's been going on. I heard that your head hurts. We're going to go ahead and get you a CAT scan. Does that sound good?
Okay.
All right. If you want to, I'm just going to assist you getting into the wheelchair, if that's okay.
Sure. I can go with him, right?
Actually, so there is some radiation with the CAT scans. We do require that family members stay in the room.
Okay. Remember what I told you.
So before you get your CT scan, I just wanted to ask you a few more questions, if that's okay. The PA Maria told me that you had a fall.
Yeah.
How are things at home?
Can I be honest?
Absolutely.
Not good.
How about your partner? How does she treat you?
Not good.
Did you actually fall this morning?
No. She pushed me.
And does that happen a lot?
Yeah.
Are you ready to get help today?
I don't know if I'm ready.
Okay. So I just wanted to let you know that there are resources for when you are ready. There you go. So there's a lot of resources out there for people who are suffering from domestic violence. One of them is thehotline.org, and you can chat or call someone and tell them about what's going on. It's also very important that if this happens again, that you come back to the ER, okay?
Okay.
And do you have anywhere to go if you're not safe in your home?
I guess I can go to my parents.
Okay. If not, if you're ever not able to get there, there are several women's shelters in the area as well.
Okay.
And you're sure you're not ready for help today?
No.
Okay. Just keep all of that in mind.
Thank you.
Hey Maria, have you gotten a chance to look at the CT for room 20 yet?
No, not yet.
All right. I have it up right here. So it's a Fisher grade 3 subarachnoid hemorrhage, and she's at a high risk for vasospasm, so we're gonna want to get her to the ICU as fast as possible.
Okay. I'll consult the neurosurgeon.